Hello, and thank you for joining us for this recorded version of the Employee Education Sessions. I'm Suzanne Coleman, the Benefits and Payroll Manager, and I'm here with Courtney Hutchison, Vice President at Aon Hewitt. We partner with Aon Hewitt to make decisions around our healthcare and wellness programs. Today we're going to talk about three main topics. We're going to talk about federal healthcare reform, cities' healthcare plan offerings, and the city's wellness works programs. Let's start just by touching on the City of Boulder's strategy. If you attended the all-staff meeting, you'll remember that we talked a little bit about how there's a guiding principle of the city's total compensation philosophy that addresses benefits. And it points out that our goal is for our benefits to be financially sustainable, both for employees and for the city, to offer an appropriate mix of benefits for our diverse population, and also be competitive with the benefits provided by other employers. This is something you may have seen before. It's our Health and Wellness 3-year plan. So we're always talking about healthcare plan design, that's the top section in burgundy, and the wellness program and the incentives offered for wellness, that's the green section at the bottom. This is the current version that goes out 3 years. However, we're already talking about 2016. So we're going to reevaluate our strategy, our employee cost share structure, our carrier, and all of the options available in the marketplace for 2016. So that's the city's strategy for keeping healthcare sustainable. Now we'll take a look at the federal healthcare strategy.
All right, thanks for taking the time to watch this video. Again, this is Courtney Hutchison, and I'm with Aon Hewitt. And I'm going to talk now in more detail about the city's healthcare plan specifically. As the video alluded, for those of you eligible for the city healthcare plans, they'll likely continue to be the most robust and affordable option for you in 2014. So I'll start first to talk about what is not changing in 2014. And as you've probably heard through various communications, the City of Boulder is making very minimal healthcare plan design changes for 2014. And that includes the fact that none of the insurance carriers will be changing either. I always like to remind everybody that preventive care has and will continue to be covered at no out-of-pocket cost to you on all 3 medical plans. That means no deductible, no coinsurance, etc. And that's going to be based on your age and your gender according to a specific schedule, and that schedule for your reference is posted on the benefits web. On the other end of the spectrum, the city does feel strongly that for individuals who have a catastrophic or unexpected healthcare situation for themselves or a family member, that there should be some sort of cap on what their maximum out-of-pocket spend should be. And that is true on all 3 medical plans. There is a cap on what you could potentially have to pay. And then lastly, the premium incentive, so the premium credit, which is tied to participating in various wellness activities here at the city, will also continue in 2014, and those amounts are also not changing. So now let's talk about what is changing, starting with the Health Savings Account, or HSA incentive. When I spoke to you last year, we did not know whether or not the city was going to be able to make another Health Savings Account contribution in 2014. I'm pleased to be able to say today that that incentive will continue for another year into 2014. The amount of the incentive is changing, however. The employees who sign up for the $1,500/$3,000 deductible plan, that's the plan that is eligible to receive the HSA contribution. Those amounts will be $800 for anyone who enrolls themselves for just single coverage. If you enroll 1 or more dependents, you're considered a family in the eyes of the IRS, and you will receive the city's $1,600 contribution. That contribution will be given to you on the very first pay period in a lump sum, which should be deposited into your account on January 15th. This contribution will be given to anyone who's currently in the Health Savings Account plan and stays there next year, as well as anybody new who enrolls in this plan for the first time. I also want to talk about the prescription drug enhancement being made, and this is in response to a lot of feedback from employees, specifically those who take preventive or maintenance medications. These are things that your doctor prescribes for you to take every day for a continuous period of time to treat things like high blood pressure, high cholesterol, control asthma, diabetes, those kinds of things. So all medications identified on a list that is posted on the benefits web, and these are medications that UnitedHealthcare feels are preventive in nature, they will be covered just like all other preventive care at 100% by the plan at the time of service. So you will not have to pay anything at the pharmacy when you fill those prescriptions. And again, if you're interested in whether a prescription you or your family members take and whether or not that's going to be on this new list, you can check that list on the benefits web. And finally, cost sharing on premiums is also changing. The city has articulated, I think, in a couple of circumstances that the overarching strategy around cost share is that not only should the cost share be equal among city employees, but also competitive with what other municipalities around the state and the nation are charging their employees for similar coverage. So as a result, those employee contributions for 2014 will change for 3 out of the 4 employee units. This slide just shows a side-by-side comparison of the 3 plans. Again, nothing on this slide is changing with the exception of the new line that says preventive pharmacy, and you can see that now that's covered at 100% on all 3 plans like I just mentioned. Other than that, deductibles are staying the same, coinsurance is staying the same, and the out-of-pocket maximum is staying the same both in and out of network. So let's talk about the 3 different ways to save money on a tax-free basis here at the city. The first is the Health Savings Account, or HSA. Again, this is only available to those who enroll in the IRS-qualified $1,500 deductible plan. The IRS has raised the maximum amount that an individual can contribute to those accounts for the 2014 tax year. If you're enrolled in single coverage, you can contribute up to $3,300. If you're enrolling in family coverage, you can contribute $6,550. Keep in mind the amount that the city deposits into your account for you, that counts towards these limits. So you can take the city's contribution and add to that of your own money up to these limits if you choose. The other important thing to remember is that any money that's left in your HSA at the end of the year is yours to keep, including the city's contribution, and it will always roll over into the future years. So do not feel like you have to go out and use that money by the end of this year. The second type of account is the Healthcare Flexible Spending Account, or Healthcare FSA. This account is available to those enrolled in the other 2 medical plans, the $500 or the $1,000 deductible plan. The IRS has set the limit, the contribution limit to $2,500, and that's regardless of whether you're single or family coverage. This type of account, unfortunately, does have the use it or lose it rule at the end of the year. So if you have not used all of your healthcare FSA money by the end of 2013, remember that you have to use it by the end of that grace period in March, or you will lose that money. Lastly, there's the Dependent Care Flexible Spending Account, or Dependent Care FSA. The IRS contribution limit on this account is $5,000. It's for dependent care like daycare, nanny, those kinds of things. It's available to all employees regardless of which medical plan you enroll in. You don't even have to enroll in one of the city plans. You can still participate in the Dependent Care FSA. This account also has that use it or lose it rule at the end of the year. I'm going to take a moment and just do a refresher on how deductibles and coinsurance work. I know this was something new in 2013, but I'd like to review it again. I'm going to start by talking about the plans that don't have that HSA component, so this would be the $500 or the $1,000 plan. These 2 plans have common components. There's a deductible portion, there's the coinsurance portion, and then there's preventive care, which is handled a little differently. So the first step on these plans is to meet your deductible. This is a very similar concept to your car insurance or your homeowner's insurance. You always have a deductible that you have to meet before your insurance company provides any benefit back to you, and it works the same way with health care. So the first step is to meet that deductible, and again, that deductible is different on the different plans. After your deductible is met, you then pay what's called coinsurance. So in this case, it's 20% of the bill after that deductible has been met, and that's the same on all the plans. So once that deductible is met, the plans work really all the same way. And as I mentioned, you keep paying that 20% until you've reached your out-of-pocket maximum. And in most cases, very few people ever reach their out-of-pocket maximum, but just in case, there is a limit to how much that can be. And then as I mentioned, preventive care, including now preventive prescriptions, are handled separately from those steps. So you don't have to meet the deductible. You don't have to pay 20%. The plan pays for the entire thing. Now let's look at this exact same example, but in this case, somebody that's on the $1,500 deductible plan and has that HSA component in place. So the same 3 pieces are there, the deductible, the coinsurance, and preventive care. The first step is still to meet the deductible. The difference here is that the city provides that money into the HSA account that I've mentioned, and you can use that money to help you meet your deductible so that you aren't personally responsible for all of it. You can also choose to save the money for the future and just pay the deductible yourself, but it's there if you need it. Once your deductible is met, this plan works just like the others. You pay 20% of all services up to the out-of-pocket max, should you even reach it. And preventive care is also still covered at 100% outside of your deductible and your HSA. Now let's look at a couple of examples with some real dollars. So I'll walk through two. They're very similar. First is Hector, and it's early in the year, so Hector has not yet met his plan deductible. And unfortunately, he gets into a serious car accident and needs to visit the emergency room. Let's look at how that bill gets handled for Hector. So the first row you see here just distinguishes the three different plans side by side. And then you see the emergency room or ER visit charge. This is the amount the hospital is going to charge UnitedHealthcare after they've discounted their bill already for being part of UnitedHealthcare's network. So that bill is going to be $4,000, a very realistic bill for an emergency room if anybody's been unfortunately having to go. So UnitedHealthcare gets the bill for $4,000. Then what do? Let's jump down to the employee paid amount line. The first thing they're going to realize is that Hector has not met his deductible yet. So Hector's going to have to pay his deductible. And then on top of that, he's going to have to pay 20% of whatever may be left of that $4,000 emergency room bill. So you can see the amount Hector has to pay differs across the three plans because the deductible differs across the three plans. He would pay the most, $2,000 in this case, if he were on the $1,500 deductible plan. Keep in mind, however, that because Hector enrolled in that plan, he automatically received $800 into his HSA from the city. If he wanted to, he could use that $800 to help offset that $2,000 expense, meaning he'd only have to pay $1,200, which, interestingly enough, is the same he would have paid on the $500 deductible plan. The next example is Frank. Frank also had to go to the emergency room when he had a skiing accident, but it was later in the year, so Frank had already met his deductible previously through some other services. So let's see how Frank's bill got handled. The hospital bill is still the same, $4,000 in this example, but because he already met his deductible, he's immediately just going to have to pay 20% only of that bill. So when you look at the member paid line, you can see it's $800 across the board, the same on all three plans. We're assuming here that because Frank had already met his deductible, he probably already exhausted his HSA fund too. If he had any left, he could use it, but in this case, we're assuming he doesn't, and therefore, his out-of-pocket expense is $800 regardless of which plan he's enrolled in. Lastly, I'd like to walk through another visual aid on how to choose between plans. So first and foremost, we're going to walk through an example here using BMEA family coverage as an example. If you're not BMEA or you're a single coverage instead, we have examples for all employee units as well as both single and family coverage posted on the benefits web, so feel free to check an example that's more appropriate to you. So before you ever step foot in a doctor's office or fill a prescription at the pharmacy, you have to pay your premium just to have health benefits here at the city. So that's what this image represents. These are the annual premiums associated with the three different plans, again, for BMEA family coverage. So the very first thought is, wow, I wish there was a way to lower those premiums. The good news is there is. So this next image shows how you can slightly reduce your premiums by participating in the city's wellness programs. And you can lower them by as much as $360 annually. So that's what these new bars represent here. Interestingly enough, if you are an individual or a family, in this case, who is a very healthy family, you receive all your preventive care, fill some preventive prescriptions, and really don't incur any health care costs beyond that, your premium is likely the only money you'll spend all year long because, again, those preventive services are covered in full by the plan. But if you're like most families, someone ends up sick or at the doctor's office, and you start to reach that deductible. So the next set of bars I'm going to show you is what if that family deductible gets met. So again, kind of worst case scenario, the whole family meets the family deductible. That's represented here by the green bars. Again, the deductible amounts vary by premium. But what you can see is when we add that to, vary by plan. But what you can see is when we add that to the premium that you pay, the bars aren't significantly different in length. Interestingly enough, through July, so a little over half the year, only 15% of city plan participants even met their deductible. The vast majority of employees and families here are somewhere in that green bar, but not to the end of it yet. Now, don't forget that those enrolled in the $1,500 plan, excuse me, also receive, in this case of families, $1,600 of HSA funds to help them offset that deductible if they choose. So let's show you what happens when that family uses that money from the city. You can see that bar for the $1,500 plan now shrinks fairly dramatically and is lower than the other two bars. So that just shows you how through combination of a lower premium as well as that very generous HSA contribution from the city ensures that this plan remains the lowest cost if you're somewhere in that deductible range. Now, what if you have an unforeseen or a catastrophic situation in your family and you go beyond your deductible? That's represented here by the additional money you'd have to pay up to the plan's out-of-pocket maximum. And what I wanted to point out is this next bullet point, that your out-of-pocket costs as a family will still be the lowest on the $1,500 plan until you exceed $6,000 in family medical expenses. So that's the point at which the $1,500 plan bar is no longer the shortest bar. Now, if you know right now that your family is going to have more than $6,000 in family medical expenses, in your case, the $500 deductible plan, as you can see here, is the shortest bar. It's important to note, however, that through July, only 3% of city plan participants even reached their out-of-pocket maximum. Excuse me. Most individuals do not come close to exceeding those limits. And lastly, I find this graph most interesting in that the $1,000 plan exposes families to the most potential out-of-pocket costs. So that's the longest of the three bars. Now, what this chart doesn't necessarily show that I think is worth noting is the speed at which the bars grow. So many of you are enrolled today on the $1,500 plan, and you have experienced some of those larger bills. So you know that you move along this bar pretty quickly. The decision I think to make as an individual and a family is, do you want to make a decision based on annual total dollars ultimately that will add together and be spent, which is what this is showing, or is it okay to maybe spend a little more over the course of the year as long as it's predictable and budgetable throughout the year? And those are just two different ways to budget, and whatever's best for you and your family is the right decision. The other question we often get is, okay, well, that's helpful, but how do I know if I'm going to meet my deductible? Or how do I know if I'm going to come close to my out-of-pocket maximum? How do I know what those bills are going to be so I can try to budget in advance? We wanted to show you a really brief video that talks about a pretty nice tool available right now on UnitedHealthcare's website, which is myuhc.com. This is a tool that can help you estimate and compare costs between locations and providers for over 100 different diseases and conditions, over 90 surgical procedures, over 500 individual services like office visits and labs and x-rays, and over 3,000 different medications. This is a tool that your doctor also has access to, or you can pull it up on your smartphone. So as you and your doctor are talking about next steps for a surgery, for example, you can compare different places to go and have an idea in advance of what this might cost you. So let's look at that video now.
Okay, so now I'd like to take a minute just to touch on our Wellness Works program and what changes you can see coming in the near future. So for this enrollment period for 2013-2014, if you complete the health risk questionnaire and attend a health screening or get results submitted by your physician by November 30th, you'll be eligible for that healthcare insurance premium credit. So that's the $15 credit per month if you enroll in the city's $500 or $1,000 deductible plan, and $30 per month for the $1,500 HSA eligible deductible plan. You'll also be eligible for the Recreation Pass for the 2014 calendar year. This Recreation Pass is going to be taxable starting in 2014. It's supposed to be a taxable benefit. We've estimated that the taxes on this will be between $1.96 and $3.58 per paycheck. So there wouldn't be necessarily a cost that you would be paying as like a benefit deduction, but you would see an increase in taxes, a slight increase in taxes, if you take this pass going forward. We wanted you to be aware of that change. And then notice that in the following year, in 2014-2015, if you complete those same two enrollment steps, the health risk questionnaire and the health screening, it will qualify you again for that City of Boulder Recreation Pass. However, in order to be eligible to receive the city's premium credit, you'll have to take different steps. And so what that means is, if you go in next year and do your health score, or create your health score through your screening and your health risk questionnaire, and you get a score of 85 or higher, you're automatically eligible for that city incentive credit. If you have a 5-point improvement over the baseline year, so if you get a 70 this year and you get a 75 next year, that automatically qualifies you to be eligible to receive that premium credit. If neither of those things are true, in order to get that premium credit, you'll need to satisfy a reasonable alternative standard. So an example of a reasonable alternative standard might be that if you are a smoker, we might ask you to complete a smoking cessation course in order to become eligible to receive the premium credit in the future. The credit amounts for 2015 have not yet been determined, but what we're talking about are those $15 and $30 type credits that we are currently giving. This is an example of what generates the health score. So when you go in and do your full screening, either on-site or with your physician, you get a score. It's in there right now if you participated in the program in past years. The score is based on these 7 categories that you see down the left side, so things like blood pressure and cholesterol. For each one of these items, you're assigned either the greenish blue, which means you're at or below target, a yellowish gold, which means you have moderate risk in this category, or red, meaning you have high risk in this category. Those are weighted and valued, and you'll see in the bottom right corner, this person has a score of 75. This slide just shows you where to find this. So when you log into SimplyWell 24 hours, 48 hours after you've had your screening, you'll be able to hover over My Health Score, and it will show you this box. For the full detailed chart that I went over on the previous slide, click on My Health Score. Information resources. So on the benefits webpage, bouldercolorado.gov/benefits, there are a lot of frequently asked questions, a lot of them particularly addressed to the health savings account since there are so many legal requirements there. myuhc.com. If you don't already have a myuhc.com account, I highly recommend that you set one up. You can search for in-network providers, use that cost estimator tool, look back at your previous claims. So what have I been spending on that prescription drug? And then also, what alternatives are there to that drug that I can discuss with my doctor? Or what alternatives are there to this procedure that I've been looking at? You can also contact advocacy for any of those types of questions, and they can assist you. But also, if you receive a claim during the year that's something you don't agree with, you think you're being incorrectly billed, advocacy can help you work through those types of issues. Their number is here on the screen. You can also find it in the benefits guide in the contacts page. I always like to point out the nurse line that UnitedHealthcare offers. On the back of your ID card, it says Care 24 and provides this number. These are nurses who are available 24/7 to help you talk through issues. So if it's the middle of the night and your child has a high fever and you're not sure whether to take them to the emergency room, which is the only thing open, maybe at 2 in the morning, call the nurse line, talk to them about what symptoms you're seeing, how high the fever is. They can give you a nurse's perspective on whether or not you should rush to an emergency room or whether there are steps that you maybe could take until a convenience care clinic or an urgent care opens in the morning. And finally, there's the benefits guide. We've focused primarily on health and wellness as we've talked today, but the rest of the benefits that the city offers and more detail on these programs is offered in the benefits guide, which is on the benefits webpage. So finally, on open enrollment, consider your medical plan options. Consider making HSA contributions of your own, FSA contributions, or dependent care contributions. These are all fantastic accounts because they lower your taxable liability. However, the HSA has the added bonus of you being able to carry it forward every year. So any savings that you put in there is tax-free as long as you're spending it on qualified services, and is a great way to save for future unexpected or expected healthcare costs. Attend a health screening and help session. We'll show you the chart on the next page where we've overlapped all of these this year so that you can attend one time and be able to address all of your health and wellness needs for open enrollment. Complete your open enrollment between October 1st and 17th if you're making any changes. So what you have right now today in VISTA is what you want to have in 2014, pay period 1. You don't have to do anything on the benefits side. It's only if you are making changes do you need to come see us at one of the help sessions, or only if you have questions, come see us at a help session. And then you only need to change things in VISTA open enrollment this year if you want to change something. And keep in mind that if you open an HSA in 2013, all those funds are going to roll over at the end of the year, anything you have left, and then you're also going to receive a new city contribution if you continue to elect that plan in 2014. This is the chart that shows you where our screenings, help sessions, and flu shots are located. I want to point out the change that on October the 9th, it was Open Space Mountain Park's annex location, and due to water damage, it's been relocated to the Cherryvale location. We are still accepting walk-ins at all these locations, so if you're not able to get into Simply Well because you're out in the field, go ahead and show up at one of these locations and they will get you through. I would highly recommend attending something that is not in the council chambers. Those are pretty full as far as attendance, so I would recommend coming to Cherryvale or the City Yards on the 9th or the 15th. Thank you so much for listening to this session. If you have any questions, please follow up at 303-441-3070, that's the HR team, or the email address hr@bouldercolorado.gov.